Hey everyone, and welcome to The Explainer. So today we are tackling what is honestly one of the most massive, life-altering transitions a human being can literally ever go through. Yep, we're talking about parenthood. Bringing a new life into the world is this incredible, beautiful journey. But let's be real for a second. It is also incredibly daunting. I am absolutely thrilled to be your guide today. We're going to take a massive wealth of medical and practical info and, well, structure it into something you can actually use. We are turning a literal mountain of medical advice into a highly visual, super easy to digest playbook.
I mean, if you're an expectant or new parent, you have probably asked yourself this exact question. Where do you even begin? When you're suddenly confronted with these massive directories or, concepts like the 35 Ps of parenting that our source material mentions, it is completely normal to feel a bit paralyzed. It's like looking at an endless, alphabetized directory of things to worry about. Everything from the immediate physical care of your newborn right down to managing your own changing body. It is a lot to process, for sure.
But hey, don't worry because that's exactly why we're here. Today, we're using MediClinic's Baby Care A-Z as our map. Our goal is pretty simple. We're taking their comprehensive, literally alphabetical glossary of pre- and postnatal pregnancy support, and we're distilling it into a practical, structured survival guide. We're going to connect the dots for you so you don't have to just sit there and memorize an encyclopedia.
Okay, let's dive into this. Here is our roadmap for today's explainer. We've taken this chaotic web of baby care and organized it into 5 manageable buckets. Navigating the care maze, mastering daily baby care, nutrition for baby and you, handling health and illness, and finally, protecting parental well-being.
All right, starting right off with Section 1, Navigating the Care Maze, where we're looking at setting up a safe and practical environment.
So a baby's health really starts with their environment. The MediClinic guide explicitly lists safe sleeping as the absolutely most important factor for providing the best possible care. It's crucial. But you also have to consider the elements, right? Sun protection is incredibly vital because a newborn's skin completely lacks natural defenses. And when it comes to clothing, the rule of thumb here is just keep it practical and comfortable. To protect that ultra-sensitive skin even further, you always want to use particularly mild detergents. And finally, if you're traveling, just plan ahead. Doing that ensures you feel comfortable, which, naturally trickles down to a calm baby.
Moving right along to Section 2, Mastering Daily Baby Care. This is all about the hands-on essentials for a changing body.
Literally from minute 1, your baby is going to go through major physical milestones. It starts right away with cord care. Right after birth, a doctor or midwife will cut and clamp the umbilical cord, and managing that healing process is kind of your first real hands-on task. As they grow, we hit teething. Now, the AZ guide notes that the exact timeline varies, but it undeniably marks a major and, let's face it, often fussy growth stage. And strung throughout all of this is a commitment to regular medical examinations. These are required at regular intervals by your pediatrician to properly track all these developments.
But, in between those big major milestones, there is the micro-narrative of constant daily care. Nappy changing isn't just a once-a-day thing. The guide specifies it's required whenever needed, before, after, or even between feeds. Then there's cutting the baby's nails. Why? Well, because a newborn has very little control over their flailing limbs and they can easily scratch themselves. And of course, bathing requires extreme care, simply because, like we mentioned earlier, baby skin is just incredibly sensitive and easily irritated.
Which brings us to Section 3, Nutrition for Baby and You, Fueling Early Development and Maternal Stamina.
Now, the number 3 is actually highly significant here. The MediClinic source material divides a baby's diet into 3 distinct nutritional phases. And the really important takeaway is that each of these phases lasts from 4 to 6 months, shifting as your baby's digestive system matures and their needs evolve.
When discussing those crucial initial phases, the medical text provides a very clear stance from healthcare professionals. It states, and I quote, "Doctors and midwives agree that breastfeeding is the best form of nutrition for your baby."
And this brilliantly illustrates the practical realities of both feeding methods outlined in the guide, because both demand high vigilance. Breastfeeding, it requires specific hygiene like washing daily with soap and water, and it demands incredible stamina that has to be supported by the maternal diet. Plus, breast tissue is uniquely exposed to fluctuating hormone levels. On the flip side, the guide explicitly notes that powdered formulas are actually not commercially sterile. Because of that, formula feeding requires extremely careful preparation to ensure safety. So basically, both paths require a serious level of vigilance and care from you as parents.
Okay, on to Section 4, handling health and illness, being prepared for the inevitable medical moments.
Now, the AZ list includes some specific clinical procedures you might not anticipate right away. One of these is a hip sonography. According to the text, this is an examination generally performed when babies hit that 6 to 8 month mark, just to check the development of their hip joints. Knowing this timeline helps you know exactly what to expect at those regular medical exams we talked about earlier.
Another clinical term you really should know is eczema. This is also known as atopic dermatitis, and it's an inflammatory skin condition that babies can develop. This actually ties right back to our first section about using mild detergents and careful bathing. Protecting that highly sensitive skin is literally your first line of defense against flare-ups of conditions like eczema.
The guide also covers elective procedures like circumcision. The text defines this anatomically as a procedure for boys where the hood of skin, which is called the foreskin, covering the head of the penis is removed.
Now, when illness inevitably strikes, the guide offers a genuinely reassuring perspective on fevers. A raised temperature is simply the body's way of activating the immune system. It's a natural defense mechanism. To help you manage these moments confidently, the guide strongly stresses having a first aid kit ready. Having that kit ensures you're prepared for potential illnesses and those lesser emergencies without having to panic.
And finally, Section 5, Protecting Parental Well-Being, Caring for the Caregivers. It is absolutely vital to understand how the guide defines postpartum depression. Commonly known as the baby blues, the text specifically categorizes this as a physical response following childbirth. Let that sink in. Understanding it as a biological reaction rather than just some emotional failing is incredibly important for destigmatizing the whole experience and helping parents actually seek the support they need.
And the physical toll begins long before birth, obviously. The text openly acknowledges that pregnancy brings massive lifestyle changes. Couples experience drastically altered sleep patterns, and let's not gloss over the fact that advanced pregnancy often brings genuine physical pain. Acknowledging this severe physical toll really validates the sheer exhaustion so many new parents feel.
Beyond the physical, there's the whole administrative load. The A to Z guide covers necessary admin tasks, noting that paternity tests are available to legally determine fatherhood. Plus, navigating maternity leave can be a total headache, right? So MediClinic highlights their partnership with an organization called Sweet Dreams, which specifically assists parents with processing their national UIF maternity claims. It's all about removing that red tape so you can just focus on your child.
But after all the medical jargon, the admin tasks, and the endless lists, the source material brings us back to this really beautiful, simple focal point. In the first few weeks of life, closeness and physical contact are extremely important for playing and development. Underneath all the strict routines, simple, warm physical closeness is the absolute foundation of your infant's growth.
And that brings us to the end of our structured journey through the MediClinic Baby Care A to Z. We've mapped out the environment, the daily routines, the nutrition, the medical milestones, and of course, the absolute importance of your own well-being. So I want to leave you with this question. With this roadmap in hand, how will you turn your parenting overwhelm into empowerment today? Thank you so much for joining me on this explainer, and I will see you next time.